My dear friends, I have an amazing news for you. We are about to start season 4. Do you believe it? I'm so excited when my producer and I started. I never thought that this was going to be so successful. And guess what? This season, number 4, do you guess what we're going to do? We're going to do the more entertaining season. We're going to interview the most challenged, the more prepared, the most knowledgeable doctors, amazing general dentists, amazing specialists of every part of dentistry that are very capable to teach us in our talks how we're gonna learn to avoid dental problems through our specialties and general dentists. Let's say, what is the pediatric dentist do? What are the kind of situations they take care of it? But before of that, I want to tell you with all my heart, thank you. Thank you for all your good comments. Thank you for all bad comments that I haven't received, but I really appreciate every single word that you have said in the program. You know, every comment that you have made, it makes me like energetic, and it gave me like the strength to continue thinking that I'm gonna make a change in this world by helping not only my community, Hispanic, from my heritage, the Latino community, talking in Spanish, the same topic on Fridays in Spanish, and the English version on Mondays. I wanted to influence every one of you to think that the mouth is the first area where our nutrition comes in, and our health in general is what is gonna count at the end of the day. Thank you once again for being with me, for everything that you've been watching and telling me how much this have helped you. That has made my life change in many ways. Thank you to all the people that continue subscribing, all the people that keep pressing the liking. So if you haven't seen any one of these, go to season 1, because in season 1, I tell them what is all about my mission. It's about to avoid dental problems, to teach you, know how good I am as a dentist. I am a dentist first, and then an endodontist. Then I have the other specialties and masters, and the PhD in craniofacial molecular biology, where I was during that period I was a student, I was able to research how to avoid root resorption. What is the molecular pathways of root resorption? And if you don't know what root resorption is, now we have an episode in season 2 or 3 about root resorption. Season 3, I'm gonna present one that is, I call it a criminal act, that you're gonna like it. But also, in my first program, and every one of them, I repeat all the time. If you have a good brushing technique, if you have a good flossing technique, what is gonna happen? You're gonna avoid dental problems, and you're gonna see a new generations that are more conscious. But so many people I see in the place I am, where wealthy people is, that it doesn't matter the money. What it matters is they need to know how to avoid these dental problems. And you know what? The majority of my patients thought that they knew they were brushing, but they didn't know how to take care of their mouth, whether with no decay, with cavities, if they were grinding their teeth, destroying their teeth, because guess what? For example, the general dentist is the most important part of you. When you see your general dentist first, it's gonna be the captain of the boat, or your prosthodontist. You're gonna know what a prosthodontist do. The prosthodontist is a specialty, goes 3 years, capable to do the reconstruction of the whole mouth if you run into an accident, but also is capable to do little cavities to big treatments. And the prosthetic dentist is the prosthodontist, is gonna help you to have not only a beautiful smile, or not only make you look gorgeous, but also to feel good, to be able to be chewing your mouth in the way you have to. Because if you are doing this with your teeth, if you clenching or grinding, and you have, let's say you have a crown. This is a full crown. I don't know if the camera captured here, but this is a full crown. And if you see this patient have a crown, but what happens when the patient has a crown and he's destroying it with this trauma? One day he's gonna fracture that crown, or the crown is gonna come off if you are doing the type of movements that you move the jaw for up and down, and you are forcing, and traumatizing. The nerve eventually is gonna be affected. And guess what? Your teeth is gonna be destroyed. We're gonna show you examples about that. And also you're gonna end up with implants. You're gonna lose your root canals. You can have root resorption because on the braces of the forces of a trauma. But guess what? You're gonna know why you should see an oral surgeon and maxillofacial that is gonna do the extraction of the wisdom teeth that are inside of your bone. Because there's a lot of risk in this type of surgeries. Sometimes we think, okay, my dentist can do it. And I'm very sure they're very capable dentists. I work with a woman, Dr. Adams, Dr. Sachel, Dr. Levine. I know they're capable, but they're so smart. I love working with them because you know what? They know when to refer a patient because it's out of our scope. I know how to do a crown, but I'm an endodontist. I haven't done a crown in 30 years. So why do I have to be doing something that is not part of what I do every single day? A radiologist. So I'm gonna direct you in to see when to see endodontists. What do we do in our specialties, in our specialty? What is our job? We're gonna interview an orthodontist. We're gonna interview Dr. Mario Paz, which is an amazing orthodontist too, and we interview several people like public health. What did public health do? Epidemiologists, what did they study? Dr. Francisco Ramos Gomez, which is an pediatric dentistry in United States, world-renowned in Latin America and United States. Why? Because he developed with another doctor the way, between many other dentists, the way to avoid the systematic approach is called CAMBRA, how to avoid decay. And we interviewing somebody in Spanish also that does the same thing in Latin America. At the same time, we're gonna know about if you have an infection on a tooth and the infection runs to the spaces of your brain, you can die of a septic shock. So you cannot be sure it's just a tooth infection. I will take care of it later. No, my dear, you're gonna learn what are the consequences. Or sometimes you can have a heart attack. Guess what? The pain is gonna be on your teeth, on your jaw, and you're thinking you have a tooth problem, and it's not a tooth problem, it's a heart attack. So you're gonna have to go to the hospital. I'm gonna talk about that in another session. Also, we're gonna talk, and I hope I can convince my mother, Dr. Evangelina Bazain, which study alternative medicine. And through her, I have to learn, and that's what I lost weight, by the way, how to eat. What is the best way to eat? I know there is intermittent diet that is not for all of them, but she has the key, the vegetables, that everything natural that we can advise now. How are you gonna have not only a beautiful smile, but also when you ingest your food, you're gonna be able to chew it correctly in the way you have to do it. And also I'm gonna teach you how to avoid a root canal, dental problems, how not to lose your bone, and then all your teeth are gonna be gone. Why? Because you're not brushing and flossing. I have patients that I said, this is the most expensive lack of flossing that you have in your life, because not only is a root canal, now you're gonna need a crown. So if you wanted to avoid to have calculus, if you wanted to avoid losing your teeth or losing your whole teeth and leaving dentures and have implants, not only is the time, the money, the suffering, the stress. We're gonna talk about, my mom is coming in season 3, which is a dental trauma. What are you gonna do? But in season 4, we're gonna talk to specialists that have to work together in combination, like if you have a big car accident. And with that, we may have combination with physicians. But this program that is in YouTube, Dr. Fanny Yakaman, which is called The Dentist, is another surprise that we have in the future. I am very grateful. So stay very alert of the notifications. As soon as season 3 finish, in season 4, I guarantee you, you're gonna have a lot of fun. So remember, subscribe to the channel, press a like button, and send us a message through Instagram, YouTube. Any comment is exactly the way you can do it, and I will be always there for you. Thank you so much, and I appreciate learning about how to take care of your mouth. Take care.